Oh, good afternoon, good evening, and welcome to our Geriatric Psychiatry Committee special program for this evening, Caring for the Caregiver. Thank you so much for your kind participation. Thank you for joining us. We want to welcome you to a wonderful evening. And before we start off our program, I just want to thank our platinum partner, PRMS, for making this opportunity possible for all of us at the New York County State Chapter. I'd like to walk you through briefly our program for this evening. We have a very special guest keynote speaker, a caregiver, Mr. Keith Alvarado, and he'll be here to discuss with us and talk with us about what a day in the life of a caregiver is usually like. Next up will be Ms. Carolina Hoyos. Ms. Hoyos is with the New York City agency. And she is in charge of caregiver supports for New York City and all the boroughs. And so we're very blessed and pleased to have her with us tonight. And we'll be closing our program with Dr. Zizek, who's from Caring Kind, who offers a lot of support in the community for caregivers. And then we'll conclude our program with a question and answer session to give the audience an opportunity to participate. And I'm just very delighted that we have been able to make this opportunity possible for all of us. And I hope that this program is instructive and that this is something that you're able to share with other caregivers for your patients that have need. So thank you so much. And without any further delay, I'd like to introduce Mr. Alvarado. Thank you, Keith.
Thank you. And thank you, everyone. Thank you for inviting me. This is my 24th year of association with Alzheimer's disease. So I've been with this for quite a while. And I want to begin with what I call a maxim. The relationship between and among the primary caregiver and the medical professionals who attend to the patient is as critical as the relationship between the medical professionals and the patient. I was a primary caregiver for my mother, Sadie, who was born in 1918, the last of 5 children, attended Washington Irving High School in Manhattan and Howard University in Washington, D.C. She left Howard to be in the American Negro Theater, and following her marriage to my father, began her career as an executive at Consumer Reports. My mother had mitral valve prolapse, hypertension, and a delicate respiratory system that was prone to infection from the time she was a little girl. She was diligent about her medical care and taking prescribed medication. In addition, she did not carry well. And I am the middle of 3 pregnancies. The other 2 did not survive. So I'm an only child. After almost 50 years of marriage, my dear and wonderful father died of cancer. My mother was 78, and within 6 weeks following, she was diagnosed with Alzheimer's disease. I wasn't surprised, as I had observed her behavior, and that's how she got to the doctor. I also knew that her mother had some form of dementia. I arranged for part-time support at home. That's all my mother would agree to, but it wasn't sufficient. I'll tell you about stopping her from driving at another time, because that was a long story. I was alone as a caregiver with a responsible full-time job, so I told my boss, the other directors, and my entire staff exactly what the situation was and what the impact might be on them, as well as me. As a Black woman who lived through segregation and any number of disenfranchisements, my mother was far more trusting of Black physicians than white. I knew that in a demented state, a Black doctor would be the best choice, and she was treated at the State University Hospital in Brooklyn, where I identified a Black geriatrician and a Black geriatric psychiatrist. My relationship with the geriatrician began as a cordial one, but I didn't think the visits were going well. So I approached him and suggested some changes. He was taken aback, to say the least. But I explained that my mother was not giving him accurate answers to the questions he asked, and she didn't begin to remember his recommendations. I suggested continuing the existing format, but I would take notes during the visits and later communicate the information to him. I told my mother that I was going to take notes because I never remembered anything the doctor said, and she agreed without admitting the same was true of her. The change forged an excellent and productive relationship among doctor, patient, and caregiver, that would be me, that lasted until my mother passed away. Both my mother's and my relationship with the Black male geriatric psychiatrist was excellent from the start. We were just really lucky. She was far more comfortable, talkative, and intuitive with him than she was when he was not available, and we had both male and female substitutes who were white. The written evaluations were proof positive of what I saw and what I experienced. It had become obvious to me that care at home could not be permanent, no matter who was in attendance, especially because it couldn't be 24/7. She simply wouldn't permit that. There were too many instances of becoming confused, getting lost, not really having a purpose. And then there was the car accident, not unusual with an Alzheimer's patient. Fortunately, no harm was done. I immediately started to identify assisted living facilities, and to make a long story short, used the doctor's influence to convince my mother that she would be going to a rehabilitation facility after suffering a respiratory infection that hospitalized her for a short time, because there was no way in this life that she would ever have done that anyway. The facility turned out to be wonderful. The social worker was wonderful, the nurses, the director, and everyone else. She often asked when she would be going home, and my reply was always in reference to the doctor. Whenever he says, you can. It took a few months, but eventually she forgot, and she had become involved in much of what the facility had to offer. So she lived the rest of her life there until another respiratory infection, the final one, took her life in 2011, almost 15 years after she was diagnosed. Through this process, I was supported by the wonderful members of the Alzheimer's support group I was in for more than 10 years. 3 of the support group members happened to live within walking distance of my apartment, and we remain in regular contact. This was a critical piece of my strength, my support, my ability to craft solutions, and my personal therapy. I was also fortunate enough to have a wonderful friend who was a therapist, and his mother also had Alzheimer's disease, and tragically he died just 11 months ago from cancer. I did, however, consider him part of my medical and emotional support team. And I hearken back to my original statement because of all of this. The relationship between and among the primary caregiver and the medical professionals who attend to the patient is as critical as the relationship between the medical professionals and the patient. Caregiving during this pandemic can be far more difficult. There are so many more situations that have to be observed, and we have to find ways around corners that weren't there previously. I would suggest this anyway, but I strongly advise everyone to be a participant in a support group. The pandemic just underlies the need. You'll have to find ways around things no one has thought about before, and much more care has to be taken in handling loved ones. I can't emphasize more strongly how important Caring Kind and the support group I was in were to me. Following my mother's death, I took training at Caring Kind to become a group facilitator and created an Alzheimer's caregivers support group at my place of employment, which is still operative today, even though I am retired. That's a very brief synopsis of my story, but I must tell you that through all of it, I never raised my voice. I never appeared to be angry no matter what my mother did, and she did some very unusual things. I would not argue even when she tried her best to get me to be an adversary. I always acted as though everything was normal, even though it wasn't anything close to that, and there was no reason to think otherwise. My job was to keep the stage set, never indicate there was a problem with the performance, no matter what the environment or any of the actors, including her, decided to do. But there was a secret in all of this, and I didn't discover it until after my mother was buried with my father in the military cemetery that we had all agreed on many years before. My mother trusted me. She loved me, and even in her most furious moments, she never thought I would do her any harm. Thank you. Does anyone have any questions?
Thank you so much, Keith. I was curious, how did you find the strength to persevere? You know, it's 15 years from the time your father passed to the time your mother made her transition. What other resources did you hang on to aside from your caregiver supports?
Thank you for the question. It has a very simple answer. I am very fortunate. I had two very good parents. I saw my parents take care of other people when I was growing up. I thought it was a normal part of life. I didn't know that there were families where you didn't take care of people who needed care. So it was just part of my psyche. And when things kicked in, so did I. It's really that simple.
If there are no other questions from the audience at this time, and I know a lot of you are on, I'm not sure if you're on the phone, but if there's no other questions, maybe we can start with our next speaker, Ms. Hoyos. Thank you. Thank you so much, Keith.
Thank you very much.
Hi, good afternoon, everyone, and thank you so much, Keith, for that wonderful story about your caregiving experience. I always enjoy hearing how folks experience caregiving because it's so different for each individual. So I'm going to share my slides. Hopefully you'll be able to see them. Please let me know if you can see them. So I'm from the New York City Department for the Aging, and I always like to start my presentations with this quote from Rosalind Carter. And the reason is because if it says that there are four kinds of people. And as we see here, it says those who have been caregivers, those who are currently caregivers, and those who will be caregivers, and those who will need caregivers. And it basically includes everyone. So at one point or another, we will require assistance, or we be providing assistance and care to someone. And so really caregiving is such a diverse group of individuals because of the fact that informal caregivers are anyone really. It could be any relative, partner, friend, neighbor. It's anyone who really is there to provide support, to provide care, to assist with all types of tasks. And a formal caregiver is a paid caregiver. And one of the things that we find sometimes at the Department for the Aging is that folks do not always identify with the term caregiver. So we've done a great deal of work at trying to educate and raise public awareness about caregiving and that terminology. In some other cultures, there is no word for caregiver because the expectation is, as Keith was saying, is that family takes care of family or the community takes care of you. And so that's why we've really been focusing on being able to have caregivers identify as such, because if they identify with that word, then they will know what services are available to them when they see the word caregiver in ads or in other postings that talk about different services. Again, the Department for the Aging does have programs that serve family caregivers. And when I mean family, I mean informal caregivers, and that could be a neighbor, a friend, like I said here. But it's really interesting because most caregivers identify with the tasks and activities and assistance that they offer the person that they're caring for. So they connect with that relationship as well as a daughter, a son, a niece, a nephew, a spouse, a partner, and the fact that they, you know, escort them to the medical appointments, that they maybe check in, that they prepared some meals, and don't really connect always with that term caregiver. And so that has been an important part of the work that the Department for the Aging has been doing. So in 2001, under the Title III Older Americans Act, funding was allocated to create national programs. So this is across the country to support family caregivers. And so these programs offer assistance to 4 different types of caregivers. So they offer assistance to anyone who is offering care to an older adult 60 and older, or to someone who is providing care to somebody with any type of dementia or Alzheimer's disease, to older relatives that are 55 and older who are raising younger children below the age of 18, so like kinship caregivers. And there's also individuals that are 60 and over who are taking care of a disabled adult. And so these caregiver programs were funded back in 2001. They continue to be funded. And here in New York City, we have 12 programs out in the community that offer services to these 4 types of caregivers throughout New York City. We have 3 partners that are specific to special populations. So one of our partners is an organization called Visions, and they serve the visually disabled population. We also have, a partnership with SAGE, and they serve the LGBT population. And we also have an organization called Hamilton Medicine House, and they offer services to caregivers that speak other languages other than English. So Chinese, Korean, Japanese. And so again, these 12 programs are spread out throughout all of New York City so that no matter where caregivers are residing, there is a program that will serve their geographic area. So here's a list of the programs. I'm sharing this because I know this is being recorded and folks will be able to see the information. So here's our list of 12 programs throughout the city. And the list of services that they offer are information and assistance. So they offer with benefits and entitlement. They offer counseling, support groups, trainings. They also do a lot of respite, and respite is giving the caregiver a break. And so that can look many different ways. So for our programs in particular, individual respite is that it's in the home. So they're able to, these programs, they're able to pay for in-home care for someone who is ill so that the caregiver can have a break. And that's with a licensed home care agency. Group respite is social adult day programs. Currently, social adult day programs are not operating as a congregate site because of COVID, but many of our programs, which I'll mention a little bit later in my slide, are doing virtual programming so that the individual can still be engaged virtually. Another respite is when it's institutional, you know, that they need to spend the night or spend a couple of days at a skilled nursing facility receiving appropriate care so that the caregiver can receive some assistance. Supplemental services is just that they assist with limited financial assistance for caregiver-related expenses. So some of the things that we've been seeing this year so far with COVID was food, obtaining food. You know, when the pause first started within New York City, caregivers were concerned about their loved ones getting food. And so these programs were able to, before the Get Food NYC program got in place and they were able to enroll folks on that, they were able to purchase groceries and other cleaning supplies and items that, you know, the care receivers were going to need that the caregivers weren't able to get to them because they could not leave their homes. And so they were really able to work very quickly to make sure that the needs of older adults and individuals with dementia were met through these 12 programs. So this is some of the participants from the Social Adult Day program. And so they are part of a pilot program that we rolled out also during COVID. And it's that for some folks, engaging virtually with the social adult day programs was not really an option because of their dementia and how far along it was. And so we rolled out a pilot program with electronic pets. So these pets respond to touch. And so the older adult is able to stay engaged. The caregiver can work and focus on an activity without worrying about their care receiver becoming anxious or agitated. And so currently our caregiver programs have expanded their number of support groups that they're offering virtually or over the telephone. So they're currently running about 35 different support groups. They're offering them in English, Spanish, Russian, and Cantonese. And they're also offering a lot of trainings online about, you know, what older adults and caregivers need to know, a cabin fever and caregiving during COVID, because that was becoming an issue, how to reduce stress and do a virtual tour of the Brooklyn Botanical Gardens. They also were doing a lot of workshops about improving mental health, grief and loss. The programs were seeing a lot of caregivers being affected by the loss of the care receiver because of COVID, and also an evidence-based program called Powerful Tools for Caregivers. And so the caregiver programs have been offering this assistance to caregivers because many caregivers have been struggling greatly during the pandemic. One, because they are at home. Many of them were not able to have their home health aides come into the homes because of the pandemic. And so not only were they required to be working from home, you know, their 9 to 5 or 8 to 4, but also having to tend to that person without having the aide in the home to provide care. So that really increased the level of stress for many individuals, for many caregivers. And so that's what led to our providers really increasing the number of support groups that are being offered for people to be able to access that support. And so, like I said, the Department for the Aging has 12 caregiver programs, but they have 9 social adult day programs. So we have 9 social adult day programs throughout the city. And so really, these are congregate sites where older adults with frailty or cognitive impairments are able to go and have recreation and socialization and other stimulation and engagement. However, with the pandemic, they had to close down. And currently, the socialization piece is still being provided, and it's being provided virtually. So they're providing classes like music therapy and memory games and other engagement activity and poetry via virtual platforms like Zoom. And so the individuals are able to engage. And it's wonderful because at times the caregivers are able also to join in. And so it becomes like a different bonding experience for them because they're able to take part in these activities together with their loved ones. One of the other things that I wanted to mention was in 2017, the Department for the Aging was mandated to hold a caregiver survey. And so we conducted a caregiver survey. We wanted to know about the New York City caregiving population. And what we learned is that there were about 900,000 to 1.3 million caregivers throughout New York City. So that's a pretty large number. And we wanted to also learn a little bit about their needs. You know, our programs were there and they were providing services, but we also wanted to see what other needs those that were not connected with the programs needed. And what we found was that they needed information about services. They wanted respite. They needed transportation. Respite was one of the services that was in the highest level of need, but it was not being met. 1 in 4 caregivers was reporting that they needed the respite, but they just couldn't find how to get it. Caregivers also reported that some of the barriers to obtaining services is that they just didn't know where to go for help, where to get help. And we learned that most caregivers in New York City are providing at least 30 hours of care in addition to their employment. So here are, caregivers in the 49 to 55 range, which was the highest percentage of demographic women. It was about 70-30, so 70% women, 30% males. And not only are they working full time, most of them, but they're also providing an additional 30 hours of care to the person they're caring for. And at least 1/3 of each of the caregiver groups that we surveyed were struggling financially. And so with this really was helpful because we rolled out back in 2018 a media campaign, and worked closely with 311, and this continues. So if a New York City caregiver is in need of support, is in need of services, all they have to do is call 311 and say the tagline, which is caregiving support, and they are connected to one of our 12 programs depending on where they reside within the city. And so this is what the ads look like. We had them in English, Russian, Chinese, and Spanish so that folks knew that there were services available, that if they identified as a caregiver, they could then call 311 and be connected to a program that would be able to assist them. In addition to our 12 caregiver programs, New York State is very lucky in that Governor Cuomo in 2015 allocated $67.5 million to develop dementia-specific caregiver programs. And so these grants were awarded. And in New York City, we have 9 community-based organizations that serve caregivers of individuals with any type of dementia. And we have 3 major programs that were funded that serve the all of the 5 boroughs. 2 of them happen to be providers for our programs as well. So not only do they run programs for caregivers under the Department for the Aging, but they also run caregiver programs under the New York State Department of Health, which is where this funding is from. And so that is, a wonderful addition to the caregiving support. So if they're not appropriate for our programs, they're also able to get access to services through these dementia-funded caregiver programs. Also, in 2016, Mayor de Blasio included caregiving as a protected category in New York City. And so this protects caregivers from being demoted or terminated because of their caregiving status. And as a result of the survey that we did in 2017, we received $4 million to support our caregiver programs. And so that really allowed the programs to grow from 10, which we had in before 2019, and from 2019 to now, we now have 12. So we were able not only to increase the number of programs, but also expand our services. And so some of the other things that are important to know for caregivers is the New York State Care Act. In 2015, this was signed, and it allows caregivers to be able to be identified in the hospitals, for them to receive training before their loved one is discharged. And this is really important in the discharge planning process because they become part of the conversation and part of the planning. And so that's really been significant. And the New York Paid Family Leave was rolled out in January 1st of 2018. And this has allowed caregivers, there's 3 types of leave. There's like military, bonding leave, and also family care. And as you see, this is the list of individuals that can take New York State paid family leave if they have a loved one who has a serious medical condition and they need to take time off. The process has been done to make it as simple as possible. There are simple forms that need to be filled out by the medical doctor of the family member who is ill. And so really, this has been a game changer for many caregivers because this is actual paid leave that they're able to take. And the person that they care for doesn't necessarily have to live in New York State. We have many long distance caregivers who live in New York, but their loved ones live in another state. They can still take that New York State family paid leave. And federally, what they've been doing is that in 2018, the Federal RACE Act was signed, and this is really calling on a national effort on how to coordinate services for family caregivers. And so an advisory council has been developed to pull in all the different AAAs or area agencies on aging, which the New York City Department happens to be one of is the largest in the country. And it's basically coordinating services for caregivers throughout the country. And so this has also been put in place, and it's a resource that caregivers have. And so if individuals are interested and there's a caregiver who just doesn't know where to start, because it is a daunting process at times, where do you start? How do I plan accordingly? How do I make sure that the wishes of the person I'm caring for are met, how do I continue to keep them safely at home with sufficient support, not only for themselves, but for myself? They can always call 311, like I said, and ask for caregiving support. The Department for the Aging also has another line that provides assistance, and it's called Aging Connect. So individuals can call Aging Connect and be able to get connected to any of the programs that are in the communities to help family caregivers. And if they need mental health services, they can also call NYC Well and receive support through that means. 311 is also the main center point for the Get Food NYC initiative, so that folks can get food delivered to their homes during the pandemic. So really, these are resources that folks can tap into if they're caregivers and looking to have their needs met. And our website also has a section on caregiving. So if individuals want to learn more about what the Department for the Aging offers through their network of providers for caregivers, they can go to our website, go into the caregiving section, and they're able to find the program in their area. They're able to also pull up a guide of information that gives them information about, you know, legal planning and Medicaid and Medicare and information about, you know, self-care tips. And if you're caring for somebody with dementia, what are some helpful tips that they can benefit from? We also have 3 videos that are available in 7 different languages. And it's basically educating individuals about who is considered a caregiver and what are the services available for caregivers in New York City. So all of this can be found on the DFTA website. And DFTA is just the acronym for the New York City Department for the Aging. And lastly, it's, you know, if you want to share my PowerPoint, I have here, and Caring Kind is included, a list of resources that's really helpful for caregivers to have, you know, about organizations that can offer assistance and support to them in different aspects. But I want to highlight the United Hospital Fund Next Step in Care program. It's all the way at the bottom here. And this website is quite useful because it provides videos on practical care tips, and it also, you know, how to turn somebody in the bed, how to change them, how to bathe them, how to do wound care. They have videos there that reside and people can just watch them at any time. But they also have guides in different languages, Korean, Russian, Spanish, English, about how to talk with physicians regarding the care of their loved one, and also how to do discharge planning. What should they be asking? What am I, you know, gathering? What information is available? And so that are all tools that caregivers can really greatly benefit from in order to carry out their role in a more efficient and a better supported manner. And that's my piece.
Thank you, Carolina. That was wonderful. Thank you so much.
Sure.
I'm going to delay questions till afterwards, if that's okay with our audience. And I'd like to ask Dr. Zizek to present next, if that's okay.
Just give me a minute to share my screen. Here we go. Okay, does everyone see that? Okay, so thank you, Carolina. Thank you for including us in your resources. And thank you, Neri, for inviting us to share Caring Kind's programs and services. I also want to thank Keith Amparato for everything he does for Caring Kind. He's also one of our support group leaders. And I want to thank him for sharing part of his story tonight. And I want to plug a podcast series that we do called Caregiver Storyteller. And you can listen in on more of Keith's story. It's a great podcast. And you can listen to over a dozen other podcasts from caregivers telling their stories. And that's available through our website, caringkindnyc.org. So just a little bit about the history of Caring Kind. We've been around for about 40 years. We started from a bunch of support groups that got together and became one of the founders of the National Alzheimer's Association. And we were part of the Alzheimer's Association as the New York City chapter for many years until about 4 years ago, when we disaffiliated from the national organization and focused on keeping our resources and devoting our programs and services to people in New York City. So we rebranded as Caring Kind in 2016, and we've been under that name since then. We closed our offices in mid-March because of the pandemic, but we've been able to continue our programs and services online, virtually through many means, and I will go through each of those programs one by one and let you know what we're doing today. So first I want to start with our helpline. I consider this the hub of our programs and services. It's the number you call to be connected to any of our services or to one of our many partners, many of which Carolina mentioned earlier. And this is someone who you can just be there to listen, tell you more about dementia, memory loss, and caregiving, get you connected to any number of resources. We have a very vast resource database. And our helpline is still active despite the pandemic. We have dementia care specialists answering the phone at home, and we have some coming into the office as well. For those calls that need kind of more attention, more of a in-depth one-on-one consultation, we have our social work services. And this service is staffed by master social workers, and they will provide emotional support. They'll talk to you about benefits and entitlements like long-term care and Medicaid planning. They can help you deal with family conflict. They can help refer to community services and connect you to some of our special assistance funds for people who kind of need assistance while they're forming a longer term plan. We have education and training that, again, has gone virtual. We offer kind of basic seminars. Our Understanding Dementia tells you a lot about what dementia is, what to expect, what are the stages, and it gives an overview of our programs and services. Our legal and financial seminar covers important documents like the living will and healthcare proxy, and just basically planning for the future. We had a Medicaid home care seminar, which helps guide you through the application process for obtaining Medicaid home care. And we have monthly special education topics. Some of the recent ones we had were home care in the time of COVID. So what's going on? What are the changes in home care now? What challenges do people experience? We had one on fun activities to do at home with the person with dementia. And that gave, with the stress on giving people, caregivers respite while the person with dementia is engaging in these activities. We also have a family caregiver workshop, which is a 4-week program, a more in-depth training for family caregivers, which deals with communication, dealing with certain behaviors, self-care. So that we're hoping to get virtual very soon. And then we have seminars specifically for professionals, and Understanding Dementia for Professionals, a dementia care training for professional caregivers. This is for home health aides, nursing assistants, anyone dealing like hands-on with people with dementia. And then we have a support group leader training. And I'll tell you a little bit about our support groups in a minute. So here we are, support groups. So we try to provide this safe environment for people so they could kind of be honest and open about their experience and the issues with being a caregiver. Our groups are what we call closed groups. They're not drop-in groups. We have an assessment and a matching process so that we're sure to find a good fit for the caregivers. And the caregivers go through like a 3-visit trial. You know, we encourage people to try it a few times just to make sure that they're a good fit. We have 83 groups across 5 boroughs. Now they're actually all either telephonic or through Zoom. And some of them will probably remain virtual. And we are starting new groups that are will start as virtual and remain virtual. Our groups are in English, Spanish, Mandarin, and Cantonese. Our groups are ongoing. It's not a limited, it's not a 6-week, 10-week program. They're ongoing, and people kind of phase out naturally, and other members join as the group goes on. We have specialty groups for example, spouses, adult children, certain age groups, and we have also mixed groups. So again, people go through a kind of assessment and matching process where we try to find a good fit. And sometimes it's just based on geography. Sometimes a lot easier to have members in a certain location. Our group leaders are professionally trained and supervised. Many of the support group leaders are our own staff. Some are former caregivers, others are social workers and other professionals. We have a Medical Alert New York City Wanderer Safety Program. I like to consider myself the original Wanderer Safety Program. My grandmother used to live, when I was growing up, my grandmother lived in our house. And when I was probably about 10, 12 years old, we shared a bunk bed, and I was on the top bunk, and my grandmother was on the bottom bunk. And she would get up in the middle of the night, put her sneakers on, and head for the front door, saying that she wanted to go home. And my job was to hop off the top bunk and run and get my parents to wake them up to stop my grandmother from leaving. So thankfully, there are more sophisticated systems these days. So we paired up with Medical Alert, and we offer an identification bracelet for people with dementia and their caregivers if they wish to have one. And this has an ID number on the back and the phone number for Medical Alert and other pertinent medical information on the back, so that if a person does get found, first responders, hospital personnel can call Medical Alert and find out who they are and any underlying medical conditions they have, and safely reunite them with their family. So we work, when there's a missing case, we work to send bulletins to hospitals, shelters, medical offices, police precincts. There's actually a police detective that's assigned to us, which helps, we coordinate with that detective to help find people. And we work with families throughout the whole incident, and work with them to kind of prevent wandering in the future. I think the statistic is about 2/3 of every person with dementia will wander at some point. So this is a very important issue. We have a very robust outreach program. We serve the African American, the Chinese, Latino, and now the Jewish community through a grant. We have satellite offices in Brooklyn, in Chinatown, and in the Bronx, serving some of these communities. And we also do all of these outreach teams have a healthcare outreach component where we try to reach we work with the diagnostic centers and medical professionals. A program that's very unique to us, I think, is our Connect to Culture program, where we have a program where we train staff at cultural organizations in New York City on how to work with people with dementia and develop programs specifically for people with dementia and their caregivers. Some are designed for caregivers only, and some are designed for the dyad, the person with dementia, and the caregiver. And since mid-March, we started an virtual and online program each week where we invite our partners to come on and give a tour, talk about an art piece, talk about some activities that you can do with the person with dementia at home. And we're hoping that even when we can meet in person again, these programs will continue online as another option for caregivers, because many of them don't have the opportunity to leave the home. Finally, I want to focus on our Care in Kind Connection Forum. Now, this is a way for professionals to directly link families to us. And it's a way to take the onus off the medical professional. A lot of times, a person with dementia and their caregiver show up at a doctor's office, and whether it's a diagnostic center or a podiatrist, a lot of times the doctor is not specialized in dealing with caregiver issues. So we developed a form where the caregiver can give permission for the doctor to send over their information to us. So it also takes the onus off the caregiver. They don't have to, go home with a bunch of forms and take that first step, hard step of calling for caregiver support. So the form is faxed or emailed over to us, and we'll reach out to the caregiver and initiate a conversation, just hear more about their story, and hopefully link them to resources, whether at Caring Kind or others in the community. And this form is available on our website. That's caringkindnyc.org/healthcareoutreach. And here's a little close-up of what the form looks like. It's very simple to complete. It's just giving the name of the person with dementia and the caregiver, who to contact, what services they might be available that Caring Kind offers, and just a place for the caregiver to sign to give consent. And there's also a place to check off if you're given verbal consent and the caregiver doesn't have a chance to sign. So we'll try to reach out within a couple of days to the caregiver to connect them with resources. Finally, some contact information. Our helpline number, 646-744-2900. Our website, caringkindnyc.org. And there's my email address, echisik@caringkindnyc.org. So thanks again, and I welcome any questions as I stop sharing my screen.
Thank you, Dr. Cizik. That was wonderful. I had no idea how many resources are available here in the city. I feel like we're really, we have a lot of great resources. We're very blessed. I know other states across the country don't have this plethora, neither the breadth nor the depth of services. So thank you so much for that wonderful presentation. I was surprised to learn that we are an outlier with the Alzheimer's Association. So when should a family contact the Alzheimer's Association? What are some of the services that the Alzheimer's Association may provide that Caring Kind would say, well, it's best to reach out to the Alzheimer's Association?
Well, certainly if they're out of the New York City area, we will refer to the Alzheimer's Association. They have very strong advocacy and research initiatives. So anyone who's interested in those areas, we will send to them. And basically, if we're at capacity and can't handle a certain case, we would absolutely refer to the Alzheimer's Association.
Thank you. I was wondering if anybody else from the audience has a question. Well, I have a question, and this is for Carolina. Carolina, the city, you've done such a great job with supporting the caregivers here in the city. What do you think is next? Where would you like to see our programs and resources be allocated to within the next 3 to 5 years?
So really, I think it's about growth, because the number of caregivers continues to grow. And I think the expansion of being able to support caregivers in a way that meets all their needs. So not only emotional, but also financial. I know that there's a lot of things in legislation where they're trying to offer support to caregiver programs because, to caregivers because of the level of financial burden that many of them are experiencing because of a lot of out-of-pocket expenses that they have annually. So really for us, it's about being able to grow the programs and what they're able to offer within services, but also perhaps partner so that caregivers can have access to other professionals. Currently, we work with some hospitals like Bellevue, where we work closely with their geriatric clinic, and so doctors there reach out to the Department for the Aging so that our providers can then reach out to those caregivers and provide support and services. And so being able to have them connect with, professionals that can offer them assistance in the different areas, nutrition, legal and planning, home safety is a big one. And so being able to expand the services. So I'm really looking forward to seeing what the advisory council of that federal legislation, the RACE Act, is able to accomplish nationally, so that there's a national response for supporting caregivers. So really it's about growth, so that these programs can continue to grow and continue to really meet the needs of caregivers going forward.
Thank you. How much time lag do you think is you've seen in your experience between the time a program is funded and the actual, implementation for the program? What is that like?
So like I said, so the programs were funded in 2001 federally through the Older Americans Act, and the Department for the Aging received the funding in about 2002, and that's when the programs were rolled out. So when it comes to funding, since these programs are already established, I mean, it's really quite soon. When we received that additional $4 million from the city, it was rolled out within that year. So the rollout was quick. The response was to be able to get the funds available so that the services could be implemented, increased. If additional funding comes down nationally or federally, I think it's also about being a quick response. It's usually within a year or two, because the funding has to go down to the states, right? Or to the cities, to the localities. And then all these entities have to put out the request for proposals, so that entities that are able to provide those services can, propose what they would do with this funding and be able to implement it. And so it was the same thing with the $67.5 million that Governor Cuomo designated. When that was rolled out, these programs began, I believe it was about 2017 or so, where they were, because during the 2016 year is when they were doing the request for proposals, and then the award notice was sent out in 2017. And so the Alzheimer's and dementia specific caregiver support programs throughout New York State really began working in 2017. So that was about, from the moment that the funding was allocated to when those were rolled out, it was about a 2-year period. So that's, I think that's the main thing. I think that, I've been in the caregiving field now for about 18, 19 years. And if we go back to what caregiving was in 2002, when these programs were funded, it's so different than what we see now. How much more education there is and an understanding about caregiving, because when they were first funded, we really had a very difficult time explaining to individuals that the client was not the care receiver, that the main client of these programs was the caregiver, and that the care receiver was the secondary client. And so that it was the dyad, right? The caregiver and care receiver together who were receiving the support, because so many programs through the Department for the Aging are all about the older adult, that there was a difficulty back then in 2002 in understanding that these programs were specific to the caregivers. So I think we've gone a long way. I think, like I said, the number of caregivers continues to grow. AARP recently updated their research that they did nationally. So if anybody wants to get more information about what the national picture on caregiving looks like, they can look up the AARP 2020 Caregiving in the U.S. report, which was recently released about last month, actually. They had one in 2015. Now this is the 5-year follow-up. And so they have updated figures that really give you a very clear picture of what caregivers look like and what they're experiencing and what their needs are.
Thank you. Thank you so much. I think the next question is for all three of you, and if you'd all like to participate in answering this, I would welcome that. But I'm curious, what, as physicians, we're very big. Obviously, we have a lot of needs that our patients have, and I think that trying to focus on the need of one patient versus the need of a community is a good thing, because we have to give to the patient, but we also have to provide for that community. And I think one of the best ways we do that kind of population health is through advocacy in public policy. I'm curious, how do you think that a physician can become or can do some work with advocacy towards the older, to benefit the caregiver, especially in the state of New York? What are some of the resources available, and what are some of the needs that you feel that are going unmet?
I can answer first if you like.
Absolutely, Keith, thank you.
In my time, which is now 24 years, I attended countless numbers of Caring Kind presentations where physicians were either present or involved in the presentations or actually delivering the presentations. So I've already seen what you're talking about. That's not unusual to me. Alternately, the two physicians that I talked about in my presentation that I had for my mother happened to be very involved. Now, part of the reason that they were involved in the Alzheimer's and dementia community is because they work for the State University Hospital. So that was an environment that not only encouraged but supported that involvement. But both also wanted to be, and in fact, my mother's primary care physician and I happened to be, without knowing it, in the same presentation at the same time, and we were both speaking. Neither of us knew we would be there.
Thank you.
So, I mean, I think also it's connecting with the entities that are providing services to older adults. And so there are a lot of community organizations that work with older adults who need who are open and are looking for the medical professional partnership in order to better meet the needs, to advocate. Like I said, AARP has a very large focus, and they're one of the largest advocacy groups as well nationally. And so they have a big emphasis on caregiving and advocacy. Part of the reason why about 46 states throughout the country have the CARE Act, it's because of work like organizations of AARP that did a lot of advocacy in order to pass those that legislation that really is to the benefit of caregivers. So it would be connecting with those entities that touch the lives of caregivers.
Thank you.
I was going to add just kind of a small step that physicians can make is just to kind of raise the awareness of the caregiving issues. When a person with dementia shows up at an office, a lot of times the caregiver isn't asked, how are you doing? So I think just being aware of the caregivers and just kind of raising awareness to the issue. And I think, I shared the Caring Kind Connection form. I think that's a great way to connect to caregivers. And there are also, I mentioned the Alzheimer's Association. There's Us Against Alzheimer's, a few other Alzheimer's advocacy groups that you could look into.
Thank you. Well, thank you so much. I really appreciate you taking the time. Thank you, Keith. Thank you, Carolina. Thank you, Dr. Sizek, Ed. Thank you so
Diaz,
much.
we do have one question in the chat. I don't know if you saw that from Dr. Brody.
Oh no, but let me facilitate that. I apologize. Thank you for bringing it to my attention.
That's okay.
I have a patient whose mother has Alzheimer's. This is from Dr. Brody's. She lives with her 92-year-old husband, my patient's stepfather. My patient is very concerned that her mother's needs exceed the capacity of her stepfather. What recommendations may I make to my patient?
I actually was in the process of answering that question. So I think the first step is to call our helpline, because it's very hard to answer that question without knowing all the details. There are so many issues that can be going on, and there's some delicate conversations that need to be had. So I think calling our helpline, talking to one of the social workers, you know, as Carolina said, like every caregiving situation is different. So it's kind of hard to give a blanket answer. And I know that's, yeah, I don't mean to skirt around the question, but I think that's the best thing to do is talk to a specialist to really get a sense of what the whole situation is.
Thank you. I'd like to just state again that the helpline for Caring Kind is 646-744-2910. Is that correct?
It's 2900.
2900. Thank you. Any other questions from the audience? Well, again, I'd like to thank all our three fantastic speakers. Thank you so much. And please stay healthy and be well, and stay in touch with our New York County Psychiatric Society. Thank you.
Good night, everyone.
Good night.
Good night. Thank you. Good night.
Good night. Thank you. Thank you, Key.
More than welcome.
Thank you. Thank you, Carolina. Fantastic.
You're welcome. Take care. Bye-bye.
Bye-bye.